The objectives are we'll be presenting the analysis framework. This is the whole thing, what it is about. We are trying to derive the proximal determinants, indicators, and appropriate approaches to gather information. And we want to also discuss the framework in diverse situations, because we have somebody from Mongolia, we have a lot of people from Nepal, and from Texas, we have from the United States. So it's great. It's going to be quite a different one, because I'm sure, all the determinants are not going to be very, very same. We hope by the end of the session, you would be able to, all of us would be able to discuss and understand which determinants of social determinants would be a qualitative or a quantitative or whatever. And to discuss the framework in diverse socioeconomic cultural conditions. So we've planned it in such a way that we will be doing a kind of brainstorming before we start. Then we'll go on to presentation of a couple of frameworks which we think is important and relevant. Then we'll have a couple of discussions on the relevant literature, and then we will do a group work, and then continue with the summarization. So now to Binjula ji. Yes, right. Okay. So let me go back to this. All right. So in your view, what do you think are the social determinants? And initially we thought we would focus only on women, because that would be specific. Then we thought it would be a good idea to take it in general, not just women, adolescents, young children, elderly, everybody. So what are your views? What do you think are the social determinants? The economic status. Okay, economic status. Anything from this side? Education. Education. Okay, very good. Occupation. Gender. The income.
Social norms.
Norms. Cultural values. Anything else? Empowerment. Empowerment could be for anybody. Yes. Ethnic groups. Great. Anything from this side?
Decision making.
Decision making would come. All right.
Income.
Income. I think somebody has mentioned income. Yeah, that's a very important. Customs. Yeah, did I hear anything from here? From this table?
Context and environment.
The environment. All right.
Employment.
Sorry?
Employment.
Employment. Okay.
Actually, we all had lots experience that yesterday also we had many papers. There are culture, social context, and many stories. We already have experiences. Here, we'd like to share some literature, how exactly they discuss culture and religion, religious influences. Social determines one culture. You already said here also culture. So in different culture, different food choice, and there are cultural norms, value system as well. For example, in Hindu, they are not allowed to eat beef. That's very strong belief that they actually worship cow. And that's and in different culture, there are so many religious value system, and that will develop in a culture. And some cultural issues I'll come in later on also. But whenever we'll do research in social determinants, we have to see culture, religion in together, whether it is related or not. And next, social context. The context, whether we discuss in which context we are buying food, whether the food is available or not, and in which social institutions we are, in which group, to whom we are interacting. All this will come in a social context, and where we are discussing it. And that is setting, home, school, college, or workplace, or restaurant, where we are thinking about the food. All this will determine what we eat and what is my choices, what choices are available. If you think about home, that we are talking about, my son always tell me that I don't imagine something else in my dinner from dal bhat, that is rice and dal, that's regular food. He always think there will be rice, that's all. I mean, in a home setting, we all think our own regular food, but when we think about restaurant, then there are lots of choices. And we also choose some restaurant with some specific menu as well. And even school, we don't have choice, whether there's hygienic or not, dry or not, something like that. So those things also we have to consider when we discuss in different social setting. And coming to next slide, discuss the different global status, social, even in a national context, whether social, which social context you are talking about. In Nepal, for example, Western social context is totally different from Eastern. And something like cultural, I already discussed in which cultural framework you are talking about. Something like in Hindu culture, something, really, and Muslim culture, they are eating this and that. They are allowed to eat this and that. That's a big issues. And next, coming to politicals, and last session, they also come to the political situation. And politics also determine whether what to produce, policies decide, and political influence will be there regarding the productivity, availability, distribution, all this will come. And regarding other, like micro level, I already discussed about family. In family also, intergenerational, generation-wise also different. There will be different in food choice, in friendship, schools, workplace. All this will come in a micro level setting. Next. There are different definitions in different literature, but here we are talking about food choices, the selection of foods from, for consumption, which results from the competing, reinforcing, and interacting influences on a variety of factors. So in this context, we are discussing what are the influencing factors. Next, please. And in this literature, I just put here this framework to make clear that whenever this kind of framework will come, we have to be very careful what section we are analyzing, what section we are trying to focus in our study. For example, here we are not discussing about the food and this chemical structure food, physiological things we are not discussing here. We are discussing a little bit food behavior and personal food behavior, person as aspect, their appearance. People sometimes they like that food very much, but if that food is not presented in a very nicely, they said, I don't like this. Presentation is not very good sometimes. So appearance, aroma, taste, all these personal things and psychological factors, food choice, things will come. But here, economic and social, and the price, economic, all these things are connected with the attitude, and then coming to the food choice and food intake. So in this conceptual framework, if we want to do some research on this food choice, we have to be careful what section we really want to do research. It will cover most of the issues, influences to determine the food behaviors. Because food intake is behavioral aspect. What are the factors which influence our food behaviors? So coming in this framework, life course events and experiences, personal food system will determine in food behaviors. Coming to next, and I'll give a little bit description of this framework. Life course. In life course, mostly in this review, in this document, trajectories, transitions, turning points, and timing. Trajectories, daily, it's from different life course time in the family, how we decide, taste, all these things, our persistent thoughts, feelings, strategies, actions, all these things is a process, it's life course. But transitions are a shift in person lives from different conditions of your health condition or different, if you feel something, if you have some problem in your health, you have to transit your food choice in different, from maybe vegetarian to non-vegetarian or to food. That is not under our choice. Maybe it depends upon our conditions. Even you can see the turning point. It's a major transition that leads to radical reconstruction of food choice, shifting from eating an unhealthy diet to strictly following restricted food. That is individual differences. If you, in transition, sometimes, in example, some of the definition, some of the literature says that if somebody married to another new family, the food choice will be different because maternal foods and the husband's house food is totally different. We have different experiences and we have a cultural shock as well in our life because of food choices, very different. Coming to the timing considers when transition turning point like life stage, childhood, what they eat, adolescent, what they eat, is different timing. So when we do research, when we want to research, analysis in life course, I think these are some points to discuss. Influences, coming to influences, we don't have to much discuss because we already brainstormed here, some ideas here already came here. Cultural ideas we already discussed, whether somebody says, this is not right to eat, this is right. This is in pregnancy in Nepal, there are so many specific cultures, like in pregnancy, I cannot eat some food, some fruits like papaya. Papaya should not eat during pregnancy. Some vegetables, after delivery, green vegetables should not eat in some culture, in community. You can predict that what could be the health status of that woman or that mother. So there are lots of examples in our different culture. And personal factors, yes, genetic factors, sensory sensitivity to food taste. This is very, very, very important. Psychological thing. I like this, I don't like this. And for 4 family members, 4 types of menu will be there if there are people to serve them. And there are always conflicting ideas, always discourse in food. If there is some little salt, then there will be fighting. Why this is there, this and that. So all this will determine, this is a personal, but it will determine and so family harmony as well. Sometimes food will be the source of conflict in the family. We all know about that. And coming to the food preferences and personality, who will decide food this time? Who is going to decide the food, menu of this evening? And who is buying the food? Some of the literature said that man is giving money. So the basket will be filled according to who is making decision for the kitchen. And gender roles, this is very important. Gender, I was thinking about to only conduct the session in gender and food choice, but it was not possible. And gender, there are lots of gender role in family. Mostly in Nepali family, women cook food, but they don't decide what to cook. Sometimes some family, mostly female, decide kitchen decision, but most of the family the decision make by the who pay the food. And then the female cook food, but they eat at last. And the food distribution pattern is very much different in different culture. In my family as well, myself as a daughter-in-law, I used to take my food at last, in the last. I was cooking food during the pregnancy as well. I was not allowed to take food in the beginning before my father-in-law, before my mother-in-law. This is the culture. And there are lots of literature on that. You can review, and because of this thing, how women are suffering in malnutrition and all. And parent responsibility, and my parents are always for food first for the children. That's very good. But sometimes mother or parents also need more food in time because of health and all, but it is not like that in many culture and many families. Next, please. Influences resource. Now coming to the resources, it is always how much we have purchasing power, and equipment, what equipment we have, and space, skills, knowledge, relationship, all these things. When you are doing research to analyze resource factor, resource is one of the influencing factor for food intake, then those kind of things we have to analyze. And social factors are system of relationship with individuals that can constant or facilitate food choices decision. I already discussed before also. Social factors, relationship, who is eating first and who is not eating, this and that relationship. Sometimes in the family setting that will come. Even in our social setting, in friendship and many things, all these social factors will come in a food choice. Next, please. Coming to the context, this is my last for the influences. Broader environment influencing food choice decision, including social institutions, economic conditions, all this summarize actually. Whatever we discussed before, all in a macro level, all this come like government policies, mass media, which is influencing a lot because we are watching television. This product came, I have to take some test for this thing. All these things is coming. Physical conditions, climates, all these things are analyzed in this model. So these are some influences. If we want to do research, we have to correlate it in different framework in specific areas. Next, please. This is economic model, but I found little bit mixed in this model. Whatever we discussed before, all these are actually added here. Food store, all this environmental availability part also all there. But here age, race, ethnicity, education also included in economic model. This is indirectly linked because the race, ethnicity, education looks bit capacity and their life stays and all. It will not directly influence in economic, but it will in fact influence if they are poor, they cannot buy education, and that will affect in their capacity to handle good food choice. Next, please. So these are some of the examples just to recap. Now, Dr. Archana will give some evidence and then will come group work.
We Googled and we found many hundreds of articles relating to social determinants and the food intake. But then we've narrowed it down to a couple of them, and I just want to bring to your attention two, which we thought was important. There was one study done in 2009 which showed that there was a disconnect between diet and health among low-income women called nutrition interventions that educate low-income families on inexpensive, healthful eating in a structured environment. And I would request you to go through this once because this discusses so much, because the assumption which we have, like low-income women would naturally tend to take food choices which are easily available. That is what our assumption is, but I would want you to read because it has given us so much information regarding what next, if that happens, what can be unhealthful eating. And another one which was very interesting, which was done in Bangladesh, was the social determinant indicators and the diet quality measures was strong, high-quality diets, which was consumed by educated and more affluent people, whereas conversely, low quality tends to be consumed by groups of low socioeconomic conditions. So what happens? What is the policy implication on this? What are the determinants that could help us guide them and change their eating practices? So these were the two articles which I thought it was important to share. And now, so what I suggest is we break ourselves into 3 groups, and then these are just a couple of examples which are here, okay? We just put a couple of variables. We would like you to identify, if you were doing a research, what indicators would be quantitative and what would be qualitative for each variable. You don't necessarily have to take these variables into account. You can generate your new ones. These are a couple of ones which we wrote, which we thought was important. A couple of them have already come up in the brainstorming session, but I'm sure there are many, many other ones which I would like you to put it up. And we would also like you to write the quantitative and the qualitative indicators. But let's have a look how Binjula ji and myself have put it, okay? For example, like there could be many variables, okay? We just took a couple of ones which were common and important. For example, like let's say age group, okay? So for an age group, probably the food preferences for an adolescent or probably a woman in the reproductive age, you could get some kind of quantitative indicator for that. But the perception on food need for that particular period of time, like we discussed in this life cycle, would be a qualitative indicator. Similarly, if you look at religion, all the classification of food intakes, I heard a lot of interesting discussions happening in that group. But the food belief system, why Newars don't take pork, why we don't take cow, beef, etc., that would be the qualitative. And similarly, if you like, in terms of race, ethnic groups, etc., the food preferences and regular special conditions for one particular point of time, but the rituals, what is done to meet that belief is the quantitative part. So similarly, we've done it in gender value system. For example, decision making, the intra-household, workload, what time of food is consumed. These are all quantitative. But how is that distributed, and what is the food consumption pattern that occurs because of this? Is it quantitative? It's a qualitative, sorry. In education, the knowledge on food value and choices in different stages of life and health and illness is one thing, is a quantitative, but the perception, the beliefs on food intake, like what do we take when we have fever, we should be taking more liquids or more solid or hot or spicy, that's a qualitative belief. And in terms of occupation, the exposure to various physical environment, workload, and food need and choices is a quantitative, but the perception behind that in different occupations, are you supposed to take this or not, is a qualitative. So we thought it would be important that the variables could be categorized into quantitative and qualitative. So when we go into research, it helps us get narrowed down.
Under qualitative indicators, we could assess about perception on relevance of rituals and social cultural norms. Importance on the how much extent they are following, or how they perceive their thing.
That there are lots of rituals, there are lots of food intake pattern, food choice and all, and adolescence, childhood, newborn, elderly, all life stages, things. And the power of one factor will vary from one individual or group or of people to the next. It's generation to generation is different. In the same family, new generation likes something, old generation likes something. This depends on the power, who decide what. That's very, very important. And multiple research methods. That is why we have to adopt in nutrition research. We have to follow the multiple research methods and need to be included to explore influences, food intake practices. We discuss lots of influences here. So we have to catch. We cannot do all. What we want to do, are we analyzing economic influences? Yes, if you stick on that. If you have big money, why don't you do all? Social, economic, all. What we are finding in our students that they want to do all. And we ask them, don't do all, do one thing only. But they said, I want to do, because it's not so difficult to collect data. When they bring the data and they will overwhelm with the data, how to put, where to put, how to analyze. So it's so difficult to analyze. I can give you one example like household environment and nutritional status. There are lots of indicators in household environment. Household environment is space, sanitation, waste management, So many indicators are there. Ventilation, so many things are there. And which indicator is directly influencing to nutritional status? Is there any? Directly? Very challenging to find out the direct relationship with those factors. So there are, those conditions will influence to bring environment, I mean, whether the family environment is hygienic or not. That will bring the infection rate. And that infection rate will bring nutritional status. That is how we have to make the pathways. Whether those pathways if you construct those pathways, then an analysis framework will develop. That is the idea. So those things we have to put in our mind. And why we have to do this? Because to improve our health status. And for that we have to plan multi-pronged intervention. And multi-pronged intervention because there are multiple factors. That is why intervention has to be address all those factors. That is the key of this session. If you want to add on this, any ideas, you are free to add on. Otherwise, we can close this session.